And it's important that we understand why we need to raise awareness. I think for most of us in our communities in which we live, we would know what one or two persons, if not more, who's been using drugs. There's still a lot of work to be done. And we have to work together. The health side, we can take care of that, we can build that out. But if we don't have the other partners that are working with us to make sure that we address this in a comprehensive way, we're always going to be challenged.
That was Minister of Health Dr. Frank Anthony as he addressed the ceremony held at the Hermanston Lodge on Monday in observation of International Day Against Drug Abuse and Illicit Trafficking. According to Dr. Anthony, a comprehensive approach is needed to stem the use of illicit drugs and should include easier access to health and rehabilitative services and collaboration with law enforcement agencies.
A lot of time we raise awareness, and these programs fail because we have not gone through the cycle of inculcating what they learn into that change that we want to see in them. And so one of the things that we've been talking about in the ministry is to set up a more long-term rehabilitation program. And if it requires people to be institutionalized temporarily, then that is what we have to do.
Admitting that all the solutions are not available, Dr. Anthony said while authorities are working on prevention, equal emphasis is being placed on education. Meanwhile, in providing an overview of the Drug Demand Reduction Unit, project lead of the unit, Dr. Travis Freeman, said over the past year, the department has developed a comprehensive package of services which offers expanded services to drug users. Currently, there are 10 facilities that offer outpatient services, and over the past 4 months, Dr. Freeman said there have been almost 80 patients and almost 300 visits were conducted with clients and relatives.
So even as we develop policies and programs and services, it's of paramount importance that they are people-centered and also that they are flexible to address those social impacts, and also to take into consideration the social determinants of health. We have to take into consideration the social economic status. We have to take into consideration education. We have to take into consideration all of these things that impact health.
But when accessing the services, Dr. Freeman said a lot of persons tend to face stigma and discrimination. And according to the Pan American Health Organization, World Health Organization representative to Guyana, the Pan American Health Organization is working with the Ministry of Education to address this by developing an online course engaging social influencers to encourage collaboration and networking among agencies.
The world drug problem is a complex issue that affects millions of people worldwide. Many people who use drugs face stigma and discrimination, which can further harm their physical and mental health and prevent them from accessing to help they need.
This year, International Day Against Drug Abuse and Illicit Trafficking is being held under the theme People First, Stop Stigma and Discrimination, Strengthen Prevention. Reporting for the newsroom, Sharda Bacchus.